Good evening, and welcome back to the Canadian Concussion Centre's webinar series, sponsored by the Laborers International Union of North America, LIUNA. I'm Charles Tatter, Director of the Canadian Concussion Centre, and I'm very pleased to be moderating our webinar series this evening, developed for individuals who have suffered a concussion, for their caregivers and healthcare providers as well. Our sessions focus on aspects of concussion that include an expert speaker presentation for the first half of the session, followed by a question and answer period for the duration. The sessions occur every 2 weeks, live on Tuesday evenings from 6 to 7 p.m. Eastern Standard Time. At this time, I would like to acknowledge the Indigenous peoples of all the lands that we are on today. Even as we meet virtually, it's important to recognize the lands we each call home and reaffirm our commitment to improving relationships and understanding with local Indigenous peoples. From coast to coast, we honor the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. For this evening's session, we would ask that when you have a question, please enter it into the Q&A section as opposed to the chat section. And you will see the Q&A icon on the bottom right of your screen in the Zoom webinar application, if that's the one you're using. Once pressed, a window will open to submit your question. If you have any technical questions, please put the question into the chat section and Christian will respond to help you out. At the beginning, we would like to run a short poll in order to gather information about who our live viewers are this evening. And whether or not you've had a concussion and whether you're a healthcare provider. So that information we would like to give you a moment to answer in the pop-up list in front of you. So please look at the list and submit your reply, because that information will help us best plan for initiatives in the future. Thank you for doing that. So hopefully you've had a chance to give us that information and we can move on to introduce this evening's speaker. And I'm very pleased that it's Dr. Lesley Ruttan, who will be presenting a talk on strategies for improving mental health after concussion. And certainly this is one of the most important issues after a concussion. And Lesley is perfectly aware of all of the problems that people run into. She's a registered psychologist practicing in the areas of clinical neuropsychology and clinical psychology. She has been a staff neuropsychologist at the Toronto Rehabilitation Institute, University Health Network since 2002. She's worked with inpatient and outpatients who've had a wide variety of acquired brain injuries. She has been working with the Canadian Concussion Centre for the past 10 or 12 years, assisting us in the development and delivery of concussion education and support workshops. She's just been marvelous as a member of our team, and she consults with the Hull Ellis Concussion Clinic group as well at Toronto Rehab, which is also part of UHN. She has served as practice leader for psychology at TRI, UHN, and has been actively involved in the training of clinical residents and practicum students. And in addition, she maintains a private practice. So please welcome Lesley Ruttan.
Thank you so much. So yeah, tonight I'm going to be talking about mental health. And as I was re-reviewing my presentation, it struck me just what a big topic this is to cover. Unfortunately, we're going to have Dr. Abe Snyderman with us for the next two sessions, and he's going to be adding to this. So this evening, I wanted to provide some background on mental health, just talk about the types of difficulties, as well as talking about the cycle of prolonged symptoms, and then get into more information in terms of actually managing mental health. And the focus will be on the non-medication, so the non-pharmacological strategies. So in terms of some background, and I apologize to those of you that may be on that aren't even from Canada, but I'm just presenting some statistics from the province of Ontario in Canada. And in Ontario, just as an example, we have about 150,000 new concussions every year. And we do know that the majority of people do experience a full recovery. That being said, anywhere from about 15 to 20, and sometimes quoted even a bit higher, of that group will go on to experience prolonged symptoms. So when you think about that, even within Ontario, we're looking, in the range of 20 to 30,000 people that are dealing with prolonged symptoms. And in terms of what those symptoms are, any injury to the brain can cause a really wide range of symptoms. They can be physical, they can be cognitive, they can be emotional, they can be behavioral. And this is just a list that I obtained from the Living Concussion Guidelines, and it just sort of gives you some examples of symptoms. And certainly in the acute period after a concussion, people can experience symptoms, emotional symptoms. There can be irritability, lethargy, this sort of thing. A lot of these also can continue into the longer term. So for this evening, I'm really going to be speaking more about more prolonged mental health issues. So we know that mental health difficulties are really common following a concussion, or you sometimes see the term MTBI, which just refers to mild traumatic brain injury. And mental health difficulties really seem to be major determinants of post-concussion wellness and how people recover functionally. That is what they get back to doing. And there's a fair bit of research to back that up. A 2019 study that was looking at mental health symptoms found that about 1 in 5 individuals may experience mental health symptoms up to 6 months after mild traumatic brain injury or concussion. And indeed, we certainly see them persist beyond that. What are the types of mental health difficulties we see? I mean, they can be wide ranging. I would say the most common ones are things like anxiety, mood changes, so depression, irritability and anger, and just emotional lability, where people find that they're fluctuating. And certainly we also see post-traumatic stress disorder, and that, tends to be more common, of course, when someone has sustained their concussion in a traumatic way. I also wanted to note that suicide, I think it's important to touch on this because we actually know that there is an association between traumatic brain injury and suicide. In a 2018 JAMA article, relative to individuals without a TBI, those diagnosed with a concussion or a mild TBI were found to be almost twice as likely to die by suicide compared to those who had not. They found an even higher rate in those that had sustained severe traumatic brain injuries. But even with the mild and the concussion, there definitely is an increased risk. In another study in the Journal of Neurotrauma in 2022, they found that in their youngest cohort, so individuals that were less than 26 years of age, there were significantly increased rates of depression, anxiety, or suicidal ideation following concussion in all of the groups. And in their adult cohort, they saw significant increases in severe new psychiatric disorders. So it's really something that needs to be paid attention to in terms of, for individuals that are actually seeing people with post-concussion. This is a bit of a busy slide, and this is where I thought, when we think about the various causes or the various factors that can contribute to mental health, I probably haven't even captured them all here. Number one is just physiological changes in the brain. So it's a direct result of the brain injury of the concussion. We know that you can experience changes. And this has been thought to relate to a dysregulation of cerebral blood flow in matching up with what the metabolic needs are of the injured brain. And this research continues, but it's clear that is one avenue by which we may see these post-concussive symptoms. Another area of investigation is looking at something called the autonomic nervous system. And this, if you haven't heard of it, it basically regulates a lot of our involuntary kinds of processes that happen. It's involved in many, many symptoms of the of the body. And so examples include things like heart rate, blood flow, breathing, digestion, and even our physiological threat response. So if you've ever heard of the fight-flight response, it's sort of that response that kicks in if we're afraid, if something happens. It's basically there to help us protect ourselves and help us to stay alive. And there are two pieces of the autonomic nervous system, the parasympathetic and the sympathetic. And the parasympathetic is often referred to as the rest and digest, whereas the sympathetic one is more the fight-flight. And their thinking can actually play a significant role in terms of post-concussion symptoms. And it seems in particular that the sympathetic nervous system may be sort of on, hyper aroused, so that people are much more on edge. And so from a mood perspective, people sometimes find themselves feeling really easily startled. They may be irritable. They may feel more anxious. And sometimes, they say, I'm not sure why. I don't really have anything I'm thinking about, but I'm just feeling anxious and kind of on edge. The third thing that I've put in here is just the impact of other symptoms that may occur after concussions. So often individuals are affected, they have headache pain, they may not be sleeping well, they may be having cognitive problems that are interfering, maybe if they're trying to return to school or return to work. So understandably, when someone is experiencing these symptoms, it can actually exacerbate the mental health issues. And then the final sort of box that I have there are other issues. And I absolutely see this in people that I see. And this is, a bit more wide ranging, but individuals that are involved in the medical legal system, they may be on WSIB, they may be dealing with insurance companies. I have to say, very often, just the interactions on some of these fronts, I find actually worsens their mental health and their emotional status. The other thing is that concussion can be or post-concussion symptoms can be quite invisible. You don't necessarily know that someone is dealing with them. And that can often lead people to feel sort of not validated. And then, of course, there's just other comorbid difficulties or pre-existing mental health issues that may have been exacerbated as well after the concussion. So as you can see, a lot of different factors to consider. The other thing that's important to consider is what we call the cycle of prolonged symptoms. So this is similar, just following up on what I was saying. You have a concussion, you can see symptoms across the domains, physical, cognitive, emotional. But then these can feed back on one another. And in the living guidelines, which I will speak to in a little bit, it has often been highlighted that, if someone is dealing with multiple symptoms post-concussion, we really want to focus in initially on pain, so headache, sleep problems, and mood. The reason being, these are really big symptoms in that, I think we all know if you haven't slept well, whether you've had a concussion or not, the fallout from poor sleep is big, in terms of mood, in terms of our thinking abilities, in terms of our functioning. So what we want to do is we really want to encourage people to watch for symptom patterns and triggers, and try and make changes or work with a therapist, so that we don't get into a negative vicious cycle whereby someone is really struggling with poor memory, let's say, and as a result they're having problems at work, and as a result of having problems at work, maybe their boss has spoken to them about their performance not being as good as it was, and then emotional symptoms may follow. So in terms of managing mental health, in Ontario, we have a really great resource. It was originally put together by the Ontario Neurotrauma Foundation. It's now referred to as the Living Concussion Guidelines. And these are freely accessible to anyone. There's a version that is for healthcare providers. There's also a version on the site that's specific for patients. And within the guidelines, they go through the most common symptoms that occur post-concussion and provide best practice guidelines for use. So here I'm just highlighting, I've just taken a screenshot from the guidelines on the mental health disorders page. And so you can see I've just put the arrow across because tonight I'm covering non-pharmacological. So, these guidelines can be helpful for, primary care providers, psychologists, and certainly in terms of the mental health disorders and other mental health specialists. And the bottom line is we want to treat symptoms whenever they cause distress, if they're impacting function and quality of life, or if they're slowing recovery in some way. So in terms of some of the recommendations there, they indicate that these non-pharmacological interventions are really critical in managing mental health disorders after concussion. Talk therapy is certainly one of those, and I've just put an example being cognitive behavioral therapy. It's certainly not the only talk therapy, and there are other ones being researched, but in terms of the ones with the biggest evidence base, that would be CBT. And certainly across CBT has been very well validated and researched across multiple mental health conditions, including concussion. I just, at the bottom here, I've put, there's an article by Silverberg, and, suggesting that CBT can assist with post-concussion symptoms, but that it is also really important to tailor the delivery to an individual's psychological risk factors. That can really make a big difference in terms of the efficacy of the treatment. So in terms of, again, there's a number of ways that we can think of for managing mental health. And it really does encompass, a biopsychosocial sort of and holistic kind of approach. I think it really requires that. And, number one is just starting with the basics. If I'm meeting with a client, a patient, these are the things that I will be asking about initially, just to see, what they were doing prior to their concussion, what they're doing now. So things like sleep, things like having a daily routine, and, is there structure to your day? Nutrition, substance use, energy conservation and pacing is important, because often post-concussion, people are more fatigued. It takes more energy to do the things that they usually do. It's not unusual for people post-concussion, if they're really symptomatic, for them to withdraw, to stop seeing friends. You know, it may be difficult to go out and socialize with a lot of people if you're really light and noise sensitive, for example, or you can't attend to more than, you know, one person speaking at a time. And then, of course, physical exercise. So I'm going to speak to each of these. Just back to the daily routine and structure, I think this one is really important, especially if someone has stopped working or going to school for a period of time, because I think we all really thrive when we have some structure, some routine, a reason to get up in the morning. And what I do see sometimes is that, you know, people that, you know, start staying up late, getting up later, mood starts to go down because they're doing less, they're less involved, not getting out, and so forth. So just sort of reviewing the basics is a good place to start. Sleep is huge, which is why it's one of those top three to inquire about. We know that research indicates that chronic poor sleep and insomnia can contribute to the development of depression, anxiety, irritability. And we know that when practitioners screen and treat insomnia, it can actually reduce those symptoms. So it's really important that is something that is looked at. Research, of course, also shows that emotional symptoms can contribute to the development of sleep issues. So this is where, you know, it's very easy to get into sort of a vicious cycle where symptoms can worsen other ones. I've also just included on here, this is a link to Dr. Parekh's talk with us, where you're going to get a lot more information on sleep. But if this is an issue, you can see his webinar on sleep. The next one is nutrition. And so this is interesting, because I think we always have people asking, well, what should I eat to, you know, heal my brain? And, you know, the research is growing, but I would say, you know, based on this systematic review that was published in 2023, they were really indicated that there's sort of a lack of interventions that have been conducted to date, that the research has sort of been less than high quality. They said it sort of ranges from fair to good. But, you know, there definitely are some things that are promising. And, you know, I don't think we can say that healthy eating is necessarily going to make post-concussion symptoms disappear. But I think there's no doubt that adopting a healthy, brain healthy, heart healthy diet is certainly not going to hurt. And that's where I've included as well the link to Bakecrest here in Toronto has put together a really easy to read and follow brain health food guide that just sort of gives you a good indication of the types of things that you should be consuming and the types of things that you should be avoiding. Physical exercise, you know, I think if there is one magic bullet, it may be physical exercise. I think we probably have the most research to suggest that this can really help a number of post-concussive symptoms, including mental health. So, you know, we know that controlled exercise can help people return more quickly to their daily activities, which is why we no longer recommend that people rest for long periods of time. We really want people gradually getting back to what they were doing. We know that physical exercise increases BDNF, brain-derived neurotrophic factor, which supports the survival and growth of new neurons and synapses. We know it can positively affect mood, stress, as well as thinking abilities. And low-level exercise can really be helpful for those that are slow to recover. A couple of studies in adolescents absolutely found that moderate to vigorous physical activity predicted anxiety severity. So in those that were doing it, they did much better from a mental health perspective. And here I've just included, if you were with us for the last webinar, we had Dr. Mark Bailey, who was actually, his whole talk was on exercise. So if you want more information, you can view that. Very quickly, pacing is something else that's important. This was just an app that was developed by a group at St. Joseph's Healthcare and Parkwood Institute in London. And again, you will be able to access my slides on our website. So if you find that I'm going too quickly and you're saying stop, you will be able to find this on the website within a week or so after tonight. The other thing that I always recommend people do if they're presenting with mental health difficulties is just to see their primary care provider, their family physician, just even to have some basic blood work done, just to make sure that there aren't any treatable causes of mood change that may be interacting with post-concussion symptoms as well. So things like thyroid, low iron, hormonal changes. So this is just something that is good just to rule out those types of things. Next is cognitive behavioral therapy. And basically cognitive behavioral therapy, it's a type of talk therapy. It's meant to be goal-oriented. It's a short-term psychotherapy. And the idea is that you learn skills and strategies, ideally, that you can take away and continue to use moving forward. There's really is a focus sort of on the here and now. And the idea is that it's a collaboration between the therapist and the client. I like this model. This comes from Greenberger and Podesky, the Mind Over Mood. Some of you may have seen this. It's basically the CBT Bible, if you will. It's a workbook. And again, the model here, you'll see the large oval basically reflects what's happening in our life, our environment. And then within that, we have our thoughts, we have our moods, we have our behaviors, that is what we do, what we don't do. And then we have our physiology, our physical reactions, what's happening inside. And what I always stress to people when I'm working with them is emphasizing the power of our thoughts. You know, we can have thoughts in our head that may or may not be true, but it's like the body and you know, it's all connected. And so if the body is hearing negative thoughts, worrisome thoughts, it will react to those, whether or not they're true or not. So this is part of CBT in terms of increasing that awareness. In CBT, the idea of psychological problems are really believed to be based in part on, yes, that inner voice that most people have, and also on just learned patterns of unhelpful behaviors that we may have been doing for a long time prior to the concussion. It speaks to automatic thoughts. So these are just the thoughts that happen. And, you know, in things like depression, they're often very negative about oneself, about the world, about the future. And, you know, these kind of go back and forth with our negative mood, because taken from that model that I just had up, there's a link there and they feed back on one another. Silverberg in 2018 had a paper where they were looking at fear avoidance and clinical outcomes from mild traumatic brain injury. And what they're talking about there is, it kind of leads into this next slide, where in CBT, we talk about thinking errors and cognitive distortions. And often what happens is when people's anxiety is high, they may start to catastrophize, meaning they're imagining the very worst case scenario. All or none thinking, you know, if I can't get this done in an hour, I'm, you know, life is over, this is a disaster, and so forth. And what it's not unusual, I've seen this a number of times in terms of the fear avoidance, where individuals have sustained a concussion or multiple concussions, and they then become hypersensitive to any sort of stimulus, whether they feel like they're going to be hit or sometimes even just bumped. You know, I remember having someone who just brushing their hair was triggering for them because their response to, they were fearing that something really catastrophic was going to happen. They're feeling like they're getting concussed again. And we know that this predicts a decline in mental health. So CBT, it really aims to encourage us to question our thoughts, to identify when maybe we are making errors, to help us look for more balanced alternatives, and also to challenge assumptions that may be leading to those. And then potentially to test out alternatives in the real world. Sorry. Just as an example, I've been working with a client, a patient who has had a few concussions, is a teacher, and was very anxious about just stepping into the hall in between classes because there's kids running all over the place. And so there was this real fear of getting hit and injured again. So, we actually had him purposely, along with, learning to sort of calm his nervous system down, experiment and test this out. And because what happens as people start to avoid, they start to avoid more and more and become more and more withdrawn. The next thing that I wanted to touch on, I know I'm probably running short of time, is mindfulness meditation. This is something as well that there's really been a explosion, basically, of research in this area, not just in the area of traumatic brain injury and concussion, but just generally. But there have been studies as well looking specifically at brain injury. For those of you that haven't heard of mindfulness, it's been defined by John Kabat-Zinn as the awareness that emerges from paying attention to something in a particular way. The idea is that we do it on purpose, we do it in the present moment, and we do it non-judgmentally. It's sort of like being here right now, and actually experiencing what's going on. Andy Pettycombe, who founded the app, you may have heard of Headspace, and he said, most people assume that meditation is all about stopping our thoughts, getting rid of emotions, somehow controlling our mind, but actually it's not. It's really about stepping back, seeing our thoughts more clearly, and just sort of witnessing them coming and going without reacting to them. Won't go through all of these. There's lots of research to suggest many benefits in terms of like, why would you want to meditate? Why would you want to spend your time doing this? There has been benefits shown for stress, anxiety, depression, pain, chronic pain, fatigue, sleep, even cognition, improvements in attention. There's also been suggestion that it can actually lead to changes in the brain. They've looked at brains structurally, functionally of individuals that have done formal mindfulness programs. They looked before and after and have actually seen some nice effects. Just another a quote that I like, and I just think this sort of reflects, I think most people can probably relate to this. Why be mindful? Like, why would we want to be mindful? My life has been filled with terrible misfortunes, most of which have never happened. So this again just speaks to the busyness and that inner voice. And this is a picture of Viktor Frankl, who you may know was a Holocaust survivor. And he said, between the stimulus and response, there's a space. And in that space is our power to choose our response. And in our response lies our growth and our freedom. So it's really talking about teaching us how to respond versus react. It's sort of, being able to take a breath, basically. Okay, I think I'm going to, skip over these ones. You can go back to this. This was kind of a neat study that was done back in, I think, 2010. And there was an app developed where they actually had thousands of people from 83 countries, wide age range, all different occupational categories, and they would just ping people on the app to ask them how they were feeling, what they were doing. And the idea was to look at, how often do people's minds wander? And what they found was that it came out as being about almost half the time people's minds are wandering. And interestingly, what they did find is that when people's minds are wandering, which is, what we do a lot of the time. There's a lot of activities we can do in autopilot where we're not actually thinking about what we're doing or being present. And they found that when people's minds were wandering, it actually made them more unhappy. So again, this just speaks to the importance of an exercise such as mindfulness. And if you haven't heard of it, neuroplasticity, again, mindfulness speaks to this as well in terms of, that ability for our brains to change. A lot of people will often say to me, there's no way I can meditate. My mind is so busy. But it is possible. And, we can change it. And neuronal response to thoughts, habits and patterns are established and they're reinforced, and they can be good or bad. In terms of mindfulness, there's a lot of different therapeutic avenues that you can go. There are two different. MBSR is probably the traditional 8-week model. You can find these all over the place, as well as mindfulness-based cognitive therapy is another one that has been shown to be quite effective. Very quickly, I'm not going to show this, but this, I put the link in here, and if you're ever looking for a good documentary to watch, there's something called The Crash Reel. And this is about an Olympic or former snowboarder, Kevin Pierce, who sustained a very severe, not a concussion, but a very severe traumatic brain injury. But this is really the story of his injury. And he very much credits mindfulness and yoga, and has actually developed a program called Love Your Brain that is provided free to individuals with TBI. Peer support, finally, is also can be helpful if you're looking for a support group. You just want to make sure that it's, not negative, that it's not stuck on what is wrong and lacking, and that there's a direction forward. I think I'm almost done here. Just again, the take-home message, in terms of there being one magic formula for mental health or for post-concussion symptoms, I don't think it's probably going to come. I think the brain is just too complex, and a good starting spot is just healthier habits. So a multi-pronged approach, addressing each symptom regardless of the cause, being aware of vicious cycles, knowing that there are treatments, effective treatments and strategies, and just starting small. I just wanted to let you know, I am pretty much done. I have included a number of different resources in terms of crisis lines, general supports, brain injury education, both in Canada, and I've included the Concussion Alliance as well in the US. Some apps and resources for mindfulness and CBT. And I just wanted to finally let people know that there is free group support available through the Kite Tele-Rehab Center for ABI. This is out of Dr. Robin Green's lab at Toronto Rehab. And basically, Dr. Green and her team have developed, it's fantastic. It's online, virtual, free group support for individuals with any kind of acquired brain injury, including concussion. So just so that you know, that is available. And I just also added the form at the very end. And oh my goodness, I've gone way over time. And one final, this is just to healthcare providers in the audience. If you haven't heard of ECHO Concussion, this is another educational opportunity at UHN. This is for the upcoming pediatric model. This is also free of charge. And the information is there. And there are many more sessions, but this is just for the pediatrics, and I'm sure you're aware. And I will stop there.
Can everybody hear me? That's just wonderful, Lesley. Thank you very much for that helpful, comprehensive talk. And having seen about 1,000 concussion patients in the last few years, certainly most of them would be helped by your wonderful, encouraging talk showing so many strategies. So we will now open it up for questions. And as a reminder, please type your questions into the Q&A section that you will find at the bottom right on your screen. When you hover over that application with your cursor, and we will be happy to answer any questions that you have. And Christian, I'm going to ask you to help me.
Do you want me
with.
to, I just opened the questions. Do you want me to?
Oh, here I
I
see
can
them
just go
now.
ahead, yeah.
Yeah,
So I
good.
see, you want
So,
me,
first question, what is a neuropsychologist as opposed to a regular psychologist? So perhaps you could answer that,
yeah,
Lesley.
that's a great question. So neuropsychologists need to have specific training in neuroscience and neuroanatomy, in working with brain injured individuals. So as a psychologists complete their PhD, and then also when we become regulated with the college, there's a College of Psychologists in Ontario, we actually have to declare areas of competence. So psychologists, there's a number of different areas. There's clinical, so I'm clinical and clinical neuro, but that basically it. There's extra training in terms of neuro, both in terms of our studies and in terms of our experience.
Thank you for that answer. And the next question is from uh, Win Sang. How does brain injury affect mental health when brain injury happens before, and compare that with after?
Brain injury affect mental health when brain injury happens before and after. I'm not exactly sure if you're asking if you have more than one brain injury, and in terms of mental health, we certainly know that individuals that have a pre-existing difficulties with mental health. So if you have a history of depression, if you have a history of anxiety, we know that those people are more vulnerable to having symptoms after the brain injury. So, if as a healthcare provider, it's always good to be, you want to be asking those questions about your patient. Do they, what has their history been? What kind, are they on medication? Have they taken medication before? Have they had any kind of psychotherapy or support as well? Because we know that the addition of the brain injury on top of that can make things worse.
Thank you very much. And the next question from an anonymous attendee. What impact does concussion have on the dopamine reward center of the brain? And have there been any specific studies looking at this and the recovery rate of people who also have ADHD? So that's a tough question.
That is a tough question. I'm not sure that I can necessarily answer that one. Charles, do you have any thoughts on that?
Well, we do know that ADHD people do suffer a lot of concussions because, in general, they're very active people. They may be risk taking, somewhat impulsive, and so they do accumulate quite a few concussions. But we do see excellent recovery in people with ADHD or ADD. They may have to alter some of the medications that they may be taking for those conditions, especially younger people who haven't who haven't grown out of the condition and are still taking Adderall or Vyvanse, and then recover, and then after they've had a concussion, they may have to actually go back on that medication. There are quite a few things that we have not figured out about the relationship between ADHD and concussion. That's probably about the best we can
Thank
do.
you.
So let's go on to another question. What are the specific structural brain changes seen from mild mindfulness? So, in fact, does mindfulness alter the brain in any way? And what does it mean? And that's from April Link.
Yeah, thank you, April. I know that some of the studies have suggested that there's actually been changes in the size of the amygdala, and the amygdala is a structure in the brain that, again, is sort of helps us to react quickly, and when, we are, in a dangerous situation. So I know that in one study, they actually found a reduced actual shrinkage of the amygdala. I think they'd also seen some changes in the anterior cingulate as well, along with changes, improvements in attention and concentration. There may be more recent ones, but those are the ones that I can recall off the top of my head.
Thank you, Dr. Ruttan. So let's go on to a next question from an anonymous attendee. I understood from previous webinars that re-hitting your head, even mildly, can result in bringing on symptoms due to the activated nerves. So are you saying that fear rather than physical symptoms may be a factor here? And this has happened even when brushing my head on top of a car. Full-blown symptoms can occur despite even thinking that it would not happen. So again, that's a pretty complex question.
It is. It's a really good question. And I'm not saying that in every case that it's not necessarily the physical symptoms. I think we really have to, ask questions about how hard someone has hit their head. There's no doubt that when someone is symptomatic and they bump their head again, there is that possibility that not that they're having another concussion necessarily, but that the symptoms may be exacerbated. But just to give you, this is sort of an extreme example, but it actually comes from my experience with someone, and they were outside and a raindrop hit them in the face or on the forehead, and they reacted internally as if this was like another hit to the head, like the symptoms came on just as they would, if they had been actually hit, harder. So I think there's no doubt that, our expectations, our beliefs, our thoughts, especially, it talked about, just the nervous system being sort of hyper aroused, and, so something clearly very small that it, should not bring on symptoms can, but I think it's very individual. So, there are those cases where, yeah, you may bump heads with someone and notice the symptoms, and there may actually, you may have bumped your head hard enough to elicit some symptoms. So I think it's a very individual.
I might add, Lesley, that with athletes, we certainly recognize that repetitive concussions are a problem, and that the next concussion that you have will be at lesser force than the last one. In other words, your tolerance for concussion goes down as the number of concussions goes up.
Absolutely. Yeah. Yeah.
So the next question is there a way to intervene with the pain cycle where the pain is no longer due to the injury, but to the chronic nature of the pain? A very good
Mhm.
question.
That's a really good question, and there absolutely is. And some of the non-pharmacological ways are indeed CBT and mindfulness. So I know that we have a chronic pain program at Toronto Rehab, the LEAP program, and it's a group-based program that deals with individuals that are struggling with chronic pain. And the group interventions are very much focused on psychoeducation, on mindfulness meditation, on cognitive behavioral therapy. And mindfulness in particular, we know that while it doesn't necessarily, reduce the pain symptoms, it can actually change your relationship with pain. Our normal response to pain is to sort of tense up. We don't like pain. We try and push it away. And so in these groups, the healthcare providers are helping people to basically, take more of that, a more sort of accepting and being more an observer and being able to sit with it as opposed to react to it. So I hope that answers. That's certainly from the non-medication side of things.
Thank you very much. And the next question is, I feel like I have more mental health issues from being denied, being misdiagnosed, and fighting them, and finally winning workers' comp, woohoo in brackets, and how that impacted my and my husband's life. Concussion I sustained. It's finally come to rest now after 8 years. Would you have any particular
Yeah,
advice on this scenario? That's really an
yeah,
unfortunate scenario, one that we try desperately to avoid, but unfortunately it still happens. So, Lesley, what
yeah.
do you
It does.
want to tell us?
I see this, too frequently, and it is very frustrating. Certainly from my perspective, when I'm working with someone to try and help improve their mental health, and then they get, an email or a letter, something that ends up being, we end up having to spend a session on sort of bringing them down from the level of upset that this has caused. And it's very challenging. It's challenging, for people that have been in motor vehicle accidents, if, they're having to deal with insurance companies. I think something that I wasn't at the last one, Dr. Tatter can speak to this, but he's been really instrumental in in sort of educating insurance companies, lawyers, and those people. I think it's really important that they sort of better understand, like they're actually, at times making matters worse and, prolonging people's recovery.
Well, thank you for that answer, Lesley. And certainly it parallels mine. Like we try to avoid having these circumstances make people worse. We try to treat people as soon as possible after an injury rather than letting them wander from, therapy to therapy that is recommended but not working. So in former years, there were many doctors who really did not understand concussion. When I went to medical school, for example, we never heard the word concussion. So there's a lot of catch up going on among healthcare professionals, including doctors. Some are better informed than others, and in terms of what we offer people for compensation from various insurance companies. Often it's very slow to evolve, but it's definitely improving. So here's another question. How do you distinguish a legitimate trigger that leads to backsliding? And I think that's a good
Mhm,
way of thinking of it, of
mhm.
symptoms and requires increased rest from a reaction that may or symptoms due to anxiety or even vestibular chain balance
Mhm.
changes?
Mhm. That's a great question. Um, and I don't know that I necessarily have the answer to it. I mean, I think usually if I'm seeing someone, I would be, you know, asking what that trigger is and what was involved, and certainly where they're at. If there has been significant, a significant exacerbation of symptoms, then yeah, I think we would definitely recommend that people scale back whatever it is they're doing, whether it be work or school or physical activity. Um, yeah, Dr. Tyler, did you want to add anything else to
Well,
that?
I agree that there can be various triggers, especially lack of sleep. If you go 2 or 3 nights tossing and turning, that is really going to interfere with your recovery from concussion. Or similarly, if you're having headaches every day and the headaches have not been addressed, then you're going to backslide. So it is multifactorial and multidisciplinary. We try to deal with that by having a concussion center that can uh, involve different healthcare professionals so that each one is an expert in the particular symptom that causes the backsliding. So that seems to me the best way to manage it.
Mhm.
So here's another question. Can irritability and short-term memory get worse over time?
That's a great question. So if someone has had a concussion and they're recovering, unless they sustain another injury, we wouldn't, we're not expecting that there's going to be, a specific injury related decline. We don't expect that there's going to be a progressive decline, for example, in your short-term memory. That being said, what I was talking about tonight is it's complicated because all of these symptoms interact with one another. So, depending on what might be happening in your life at that time, you think to that blue oval, the CBT, maybe you have something going on in your family, there's something going on at work that's, resulting in, your mood going down, you being more irritable. As a result, maybe your attention is not what it usually is, and as a result, you notice your memory being off. So no, we don't, again, we wouldn't expect as a direct result of the concussion that things are going to progressively get worse.
Here's a great question as well. Does the Concussion Center do any training of WSIB re the impact that they have on people's mental health? Um, Maybe I can answer
Yeah,
that
I'm gonna
too.
let you answer that.
We've just completed a study that was funded by the WSIB on concussion management and whether we can develop better tools to identify people early on. And I'm pleased to say that the study did show us a better pathway, and we are sharing that with the WSIB, who were the sponsors of this study. And that's a real coincidence because just right now we're writing our final report to the WSIB telling them what we found. So it's very good
That's great news.
question. So I think we have time for one more question. Unfortunately, there's still quite a few. Connor is asking, um, I am curious to know your opinion on psychological readiness in return to sport or return to work and the adverse effect that can occur due to a lack of psychological readiness to return.
Yeah, that's a great question, Connor. I mean, whenever I'm talking to, if someone hasn't returned to work, for example, I always say, you want to be ready. You want to be ready physically, you want to be ready cognitively, and you also want to be ready psychologically. That being said, like, we also know there's consequences to being off work. Generally, people do better when they're at work, and when they're back at doing the things that they want to do. So, there's always a risk, of course, of people going back too soon. And I've seen that too, where, as opposed to being avoidant of things, they don't take a day off, like they just are back in there, and then sometimes they will kind of decompensate a little while later. So I think it is important to ensure that whatever you're doing, whether it's returning to sport, returning to work, to have some professional guidance and to do it gradually, not just to go from 0 to 100. You want to, make sure that you're, in that way you're able to sort of assess, whether it's, going in part-time initially and see how that feels and then progress from there.
So thank you for that, Dr. Ruttan, and thank you for your excellent presentation. I think we're now nearing the end of this evening session. I'm sorry we didn't get to all the questions that were asked. We will be forwarding a short survey to you by email to obtain your feedback on tonight's sessions. So your thoughts and input would be most appreciated if you have a few minutes to spare. And also, as a reminder, the next session is on November the 5th, 2 weeks from tonight, with Dr. Abe Snaderman, presenting anxiety, depression, and PTSD. So tonight is a perfect prelude to that. And he will be on, in fact, for the next 2 sessions, so November the 5th and November the 19th. So thanks again to Lesley Ruttan and to Christian Peterson for the technical help, and thank you to all for coming to this session.
Great. Thank you. Good night.